By not addressing climate change, we're effectively creating our own patients. I could be anybody in that hospital setting and I could lead a change. You're so invested into looking after that patient, but the more and more you're looking after different patients and different things that are coming through the door, you're actually realising how much of your job is actually looking outside of those doors. Don't let perfection get in the way of good.
I mean, I've got asthma, but I don't think weirdly you don't put that two and two together.
And I just love at Great Ormond Street that the plastic stat is actually to make it more relatable to the children, it's actually 3.5 Tyrannosaurus Rex's worth of plastic. I would hope that everybody had the ability of carbon literacy.
Hello and welcome to Leaf Media Global Podcast, a space dedicated to professionals and enthusiasts dedicated to ESG, environmental, social and governance. In this series, we are highlighting inspiring careers, innovative strategies and bold visions which are tackling climate and social emergencies. I'm your host, Ben Stimpson-Wood, Climate Engagement Manager at Greenly, hosting the first UK season where we spotlight leaders reshaping sustainability in business, healthcare and beyond. This podcast is produced by Leaf Media and powered by Greenly. Greenly is a leading ESG management platform helping companies measure, report and reduce their carbon footprint. Operating in both Europe and the US, Greenly empowers companies to turn their climate commitments into actionable strategies. We have grown into a trusted partner for businesses of all sizes, offering automated GHG reporting, greenhouse gas reporting, compliance with frameworks like CSRD and SBTI, and offering tools for supplier engagement and life cycle assessments. So today, we're driving into a topic that's both urgent and deeply personal: how the NHS is tackling the climate crisis, a challenge the World Health Organization calls greatest health threat of the 21st century. I'm very happy to be speaking to Imogen, Head of Sustainability Education and Implementation Manager at Great Ormond Street Hospital, a leader for sustainable healthcare in the UK, paediatric care globally. So welcome. Thank you very much. Imogen is a clinician who is leading sustainability efforts. She is a registered nurse who specialises in critical care, spending 6 years as a charge nurse and senior nurse educator at Imperial College Healthcare critical care sites. Then became a Chief Sustainable Officer's Clinical Fellow at the NHS England, where she helped shape national nursing strategies for sustainability. At GOSH, she is now translating the national net zero goals into local daily practices. So, Imogen, thank you very much for joining.
You.
So I guess where we want to start is, let's start with you and your story. How does a clinician become a sustainable leader?
I think that's a great question to start with, because I think there's so many different options for a healthcare professional in any shape or form to take into the space of being a sustainable leader. And I think leader as a word itself is quite an interesting concept, because what does that even mean? I think for a clinician, it means there's quite a historical, hierarchical kind of way that you might think of a leader, whereas actually I think in the sustainability space, anybody has the ability to be a leader in no matter what rank, grade, whatever you perceive yourself to be, as long as you've got the autonomy and the passion and drive to do something. So I think
100%.
There's lots of different ways to sort of think about it, but certainly from my perspective, coming from a nursing perspective, it was very much I grew my nursing leadership in quite a standardized ways, and you might notice many other nurses go through the same thing. You go through university, you start going into general practice, and you might specialize like I did in critical care, and I then transitioned from clinical practice into education. And it was actually only really when I stepped into education that I noticed that I really had a platform to transition my sustainability from a personal perspective into my professional capacity. So it was really from then and in that sort of space that sustainable leadership really came across.
Yeah. No, of course. And I guess that's kind of would you say that was the main pivotal moment for you, and like what was driving, or would you have something that was really driving the shift, driving the motivation to get into the role?
I don't know. I think pivotal moment was, I think when I was an educator, I sort of started seeing the links. It was beginning to drive some sort of passion of, I've actually got an influence to really advocate. I've got so many people that are here listening to me teach or whatever it is. And it was at the time with the COVID pandemic. That's when I was in critical care. So we were enrolling like military staff, up to like 200 members of staff a day who are literally there to sort of take on board. And I was thinking, what if I could get them to take one thing that I've taken away today? Yes, it's obviously to provide the best patient care we can, but is there something else that I can do to inspire them to do, to look outside of the four walls that we're in? And that was when I then applied for the Chief Sustainability Officer's Clinical Fellowship, and that is when the real, I knew that there was interest, there was drive, but that's when it really cemented my career's kind of switched.
Flew up, big time. Okay, amazing. So in the healthcare setting, I guess, how does this transition normally happen? Like from clinician to senior leadership roles? Like, is it a normal thing? Was it an easy shift? Obviously you applied, but were you stressed while doing that? I guess.
I guess I was. And I guess so much of the clinical leadership, and especially in the sustainability space in healthcare, is mainly or historically been driven by doctors. Like medicine is like such a big thing. So quite often the other professions, not that they aren't at the table, but maybe they're not sure if they're allowed to be at that table, or they're not quite entirely sure what their place is. And I think
they feel like they're not allowed. They feel like they're not allowed to be there, or they feel like they can't be there.
Or for some reason there's that sort of assumption that the doctors are handling it, so we'll carry on. I'm not sure what it is. I think there's many different arguments for what that might be, but I think especially nursing in particular, I'm speaking from that because that was obviously my profession, so it's the best perspective I can come from. But I think we come from a place where you just kind of have to get on and do we're quite a humble profession in the sense you are generally troubleshooting, fighting fires on a daily basis that you don't often.
It's a stressful job anyway.
It's so is being a doctor. I'm not taking that away from it at all, but I guess it's just maybe you don't always have the sort of ability to think that you can step outside of that remit as much as, say, in the medical training, you're pushed to look and explore different avenues, whereas so it's slightly different. So I think, that sort of clinical leadership in the sense of you can probably grow in quite traditional ways of you might grow up in an organisational management way or operational management in clinical staff, or you might go into that more corporate side of things of other elements. But I think, as I sort of said in my first answer, I think that the leader, as long as you've got in sustainability, as long as you've got some passion and some autonomy, then you can be a leader in any shape or form. I could be I could be anybody in that hospital setting, and I could lead a change. It doesn't have to be that I'm above this grade, so I can now lead it. Anybody
I think the passion's a key word there. Like, especially in sustainability, you have to have the passion behind it. Otherwise, it's caring for the planet, right? If you don't care about it, you're not going to be a very good sustainable officer, are you?
Exactly.
So amazing. So I guess then, how does your clinical experience inform the work today? So like looking back at the journey from nurse to sustainability leader, what's one piece of advice you give clinicians who want to drive change but feel overwhelmed by the scale of the climate crisis?
Yeah, that's a tough one because it's
a lot.
There's a lot that carries with sustainability. You want to do everything everywhere all at once. Like if you've got the passion, you've got the drive to, it can feel super overwhelming that how do I tackle everything around me? It's not just the patient that I'm looking at, it's what else is outside of those four walls. And I think that's where my sort of passion really drove from it, because you're so invested into looking after that patient, but the more and more you're looking after different patients and different things that are coming through the door, you're actually realizing how much of your job is actually looking outside of those doors to actually care for them in a wider setting. So I think maybe my piece of advice would probably be, is a piece of advice that I actually got told during my fellowship, and it's really stuck with me, is like, don't let perfection get in the way of good.
Nice.
So I think it's really easy. I'm a perfectionist myself, so I have to tell myself this a lot. But you can't expect everything to be perfect, and you have to also be patient with it, and don't let that paralysis, I guess, stop you from doing something. It doesn't mean you have to do everything tomorrow. You can just do one or two things you can do tomorrow that you can repeat again and again, and actually then you are sort of chipping
steps,
away.
Isn't it? Like it's kind of, you wouldn't jump a ladder.
You'd
take a step at a time, sort of thing. And I do think that's important. And again, it goes back to You learn from your mistakes so much faster.
Definitely.
Like, fail fast.
Yeah.
As soon as you failed, you're going to learn from the mistakes.
100%.
And it's the best way. And as we've mentioned, sustainability is a tough ask when you actually deep dive into it. There's a lot of layers.
It really is. There's so
a lot
many
of layers. So interesting going into this one. You mentioned about your patients. Did you see climate change like impacting or directly impacting the patients you were looking after?
Yeah. So I think it took me a little while to really make, like, I knew the connection, and some of them were quite obvious. I think say if there's been like some severe weather events, like we had a heat wave, the amount of patients that you'd see coming into ICUs with cardiac or respiratory problems that are directly like caused by that increased heat. That feels quite an obvious connection. You think, I can see that. But it's the ones where you've got a child presenting to A&E with, say, like a silent asthma, which is actually from the poor air pollution. And it's kind of, yes, that is the cause, but sometimes it took me a little bit longer to actually realise that it isn't just the big severe events that's all over the news, that's what then causes that patient. But it's actually just the general public health and the public prevention of the health that we need to be looking at. And it took me a little while. Not proud to say it, but it took me a little while in critical care, because you're so just absorbed by the patient in front of you, and you're thinking, right, I need to look after this organ, that you're not. Well, it took me a little while and more confident. I guess that's where the leadership maybe comes in. More confidence and competence to be able to recognise, okay, this is happening, but why? And then it's when you can start asking the why and be a bit more curious. I think that was when I was really like, wow, okay, it's actually so, for me, so blatantly obvious as to what the impacts of climate change are to health.
Yeah, it's interesting you say that as well, because like, I mean, even coming on the tubes in London and everything like that, you don't really think about it. I mean, I've got asthma, but I don't think, weirdly, you don't put that 2 and 2 together, but you definitely should. Yeah. And it's, that's a really interesting way of putting it, actually. Because, you're sat on the tube every day and you just think, oh, this is fine. And you're like, this is not fine. So it is interesting. Definitely. Okay, amazing. So if we're going to zoom out a little, why should sustainability be non-negotiable priority for every hospital? Can you maybe explain to me like what the relationship between climate change and health is? I think the why, as to why it has to be non-negotiable, for me feels so straightforward, and I don't there's so much research, resources, everything out there that can really give a strong argument as to why. I think that is it's a non-negotiable that's even a question. We know that there is an impact of climate change to health, and therefore the NHS, what is it? It's in its 76th year now, was originally set up with the foundation to look after all of our patients now and for future generations. And that basis was made on as all healthcare settings, I imagine, across the world, is based on that we have a stable environment. We can now see across the globe, including the UK, that we've got an unstable environment, and a growingly so. So it means that we're effectively, by not addressing climate change, we're effectively creating our own patients. Like, we're just going to see more people come through the door if we don't address it, because we know the implications of air pollution and all the severe weather events and rising sea levels, and even food scarcity, so malnutrition and all of those kind of elements that come to it, and let alone the sort of more slow increase of temperatures, which leads to different vector-borne diseases, waterborne diseases. We see so much more. It's a domino effect in the end of the day, isn't it?
And we're seeing even more research into the mental health implications that has. Like, even there was a study that I was reading not even a couple of days ago of microplastics and its association with increased ADHD. Like, we're really seeing a lot. So I think that the fact that if we're in a healthcare setting and we want to be giving the best possible patient care, we need to be addressing what we can from a sort of social equity, social justice. There's so many different determinants of health that I guess,
talk about it. You could talk about that one question for a while.
Definitely. But I think, if we want to be able to continue to provide good quality healthcare, then we have to start addressing climate change and lowering our emissions.
Starting at the source. Let's start at the source instead of picking out the little the pointless stuff sometimes, and it's just like, come on. So going back to like being a registered nurse and an educator in the space, how do you see the relationship between climate change, health and education? Taking
my journey as an example, I feel you need to have I've slowly learned the relationship between climate change and health. And
Yeah.
I feel there's a lot of research out there, so if people want more, they can look into it.
There's
But
lots of materials, isn't it? Yeah.
being an educator in this space is being able to allow people to start giving them the capability and the capacity to start thinking why, or just being a bit more curious and actually understanding that their actions might have an implication towards climate change. And it's not to put shame on anybody or say, oh, you've made the wrong decision, because there isn't going to be a right decision all of the time. You're never going to get that. But I think that education part is so crucial to help people understand what can be done, what is there. And I think there's been a real transition in sort of the health and climate space where there was a lot of talking for a good amount of time. There was a small amount of people that are invested. It's grown and grown. I've seen that from even just from the last couple of COPs that I've been at. The health community has grown exponentially in the last, say, 15 years. And it was a really big piece about advocacy. And I think that's where the education comes in, because we need to help advocate for it. But I think the bit that we've got to now, and I think we're really seeing a lot, and especially in the UK, is that we're now moving into that sort of action-based bits. So we know the what, we know the why, but is then that, so then how do we then transition that into day-to-day life, practice, healthcare at a local, regional, national level, however that might look. And I think that's
it's the hardest bit.
That's the bit where an educator or education really comes in, because we need to be able to equip everybody to be able to have the knowledge and tools to be able to act in a way that's beneficial.
Yeah. It is a lot, isn't it? When you break it down and you actually think about it, especially on the educational side, it's cool because you could be at the forefront of teaching all these people. And you could do that, and like you could be the reason why it's driven.
Definitely,
it's exciting.
And it's amazing that I've got an education role, that I've got the platform, I've got the influence where I can literally stand up and almost force people to listen to me talk for an hour about what it might be. But it's also like
you will sit down.
Exactly.
You will listen. We will sort the planet out.
You have to sit down and listen to every single word I'm saying and take it away. But it's also then the education of what people can do in day to day. Like I could do a lecture and someone might take one thing that I've said away from it. I'm aware I might have a monotone voice, I'm boring as anything, it's fine. They've taken one thing away. But if they're able to go home and go, oh, I heard this women lecture today and this one thing that I said, and they take it to their dinner table and they have a quick discussion about, oh, did you know that air pollution I don't know. Hopefully something a bit more profound than that. But even just that is one that you're sharing little golden nuggets of education to each other. And I think just having a conversation is education in itself, as long as obviously you want to go and find out.
It's taking the one thing away. So you could go back to like improving 1% every day sort of thing. And it's like you're learning, if you learn one little thing, and if you can give someone that, incredible.
Definitely.
Like, it's amazing. No, that's really cool. So shifting to net zero and healthcare net zero, what does net zero healthcare look like on the ground? Like, how does it translate into local healthcare practices? Obviously, like Mr. Matthew Shaw, CEO, Great Ormond Street, said it's now not enough to treat the child in front of us. We have to treat the environment that they are in, kind of what you were talking about. So how does this top-down goal become bottom-up change in hospitals like GOSH? So
I think that's it's an interesting question, because I think the UK in particular is quite unique in its healthcare sort of setting. And the fact that in 2020 we've got these incredible ambitious sort of targets, ambitious, but also we want them to be quicker. So I don't know how, maybe how ambitious is the wrong choice of words there, but we've got those 2040 and 2045 targets. And then within the Health and Care Act from 2022, we know that from that, all 212 NHS trusts have to have their own green plan. Every single integrated care board then has to have their own green plan. So even though we've got these national targets and maybe some advice and some like tools as to how you can then start thinking about decarbonisation, they've almost given the whole like complete flexibility to each ICB and trust to be able to think about what that means for them in a local perspective. So it's not prescriptive. It's advisory, but it's not prescriptive. And I think that's really important in such a varied healthcare setting, because what might work for one GP practice or one acute hospital in the centre of London, as opposed to, say, a community hospital in the Isle of Wight, how they procure or whatever they do, their practice is going to be very different. And their pockets of influence on carbon might be really different. So I think that's really important. So I think what that's allowed, that sort of trickle-down effect, that top-down effect of sort of having those mandated requirements, and the fact that then that requires a person to hold responsibility for that in each ICB or trust has allowed hopefully each trust to look what can they do locally. And at Great Ormond Street, that happened back down in 2021. They were really looking at it as when they declared the sort of
the emergency,
climate health emergency, and that's I think that it's a really good place to be able to start looking at, okay, what is our first point of call might be, what is our carbon footprint? We don't know where to tackle. Where do we start? And I think that's really helpful, because although we've got the national carbon footprints, looking at it like that, it makes it really quite helpful. And especially at Great Ormond Street, they've created their own, we've created our own targets, in the sense that we're actually hoping to have our GOSH carbon footprint for the emissions that we control by 2030. So we're trying to be really ambitious. And what we can do, and that's predominantly looking at things like business travel and our building energy and estates. And we've got the privilege that we're currently having a new children's cancer centre being built, which is just in its process of being built now. And that's been a really advantageous place to start looking at, right? So what would that building look like to provide sustainable healthcare? But not all hospitals are going to have that ability. But I think so I guess it's really looking at what your pockets of influence are, and then how do you break that down? I think breaking it down in each area is so tricky. You might want to break it down into buckets of carbon, or it might be in your specialities, or it might be in the levers that you hold. Like, how do you break down what you're going to do? And every trust is able to take their own perspective. And at Great Ormond Street, we've sort of divided it down into 10 programmes of work. Some of them much broader, some of them much smaller. Like, one might be travel and transport, it might be food and nutrition. And there's also the broader perspective of our people is one. So like, what can we do to integrate sustainability into their day-to-day? Is it in their job description? Is it in
of course,
meeting handovers and things like that? So I think there's so many different ways you can approach it, and there isn't a right or wrong. And I think, because I've worked in Imperial, Nottingham, NHS England, where I got to work a lot with a lot of regional teams sitting in the National Nursing Office, and then now at Great Ormond Street, it's that I think it's really, when I was working in NHS England, it feels quite not easy, but you've got the ability to kind of give direction, you can advise. But now then that transition into the actual implementation phase is when it actually gets quite tricky, the actual delivery of that policy looks great and I really understand everything that's in it, but how do I actually translate that into this specific children's intensive care ward, which actually has got X, Y, and Z.
The ideas are great,
really,
but how do we do it?
And I think it's so much of that, it's just learning from other trusts as you go around.
I think you're not alone with that, though. I think a lot of people are struggling with those. I mean, everybody's going to grow, it's the argument of, you're always going to grow, but how do you bring down the emissions at the same time?
Exactly.
Like what you just said about, there's going to be loads of hospitals always opening up, and they're important because everybody needs hospitals, everybody, like the cancer place. But you're going to add more emissions with that. 100%. So how do you solve this problem? I think that's everybody's challenge, really. So good luck with that one.
Thank you. Thanks so much.
I've got your back, Imogen. I've got your back.
But hopefully, it might be a little peak, but then hopefully that allows
it'll
for
go down again. But
decrease.
I think people will be okay with sometimes with the NHS maybe doing some things like that.
And there's some things that are totally out of our control as well. I think COVID, for example, that's a huge emissions peak.
It's not a lot you can do about that.
But we can only learn and try and improve for next time.
So you mentioned, obviously, GOSH declared its own climate health emergency back in 2001. It was the first London hospital to have done so. Can you walk through us this decision a little bit? What are the programmes you put into place afterwards, maybe? And what impact have you seen then from them on maybe a local, a national and an international level?
So it was the first London-based one, because I think we followed Newcastle. They were one of the first to do it. And I think the key thing that I think that provides is the ability for everybody that's walking through the doors of Great Ormond Street, patients, children, staff, whoever it is that's accessing Great Ormond Street, can see that we're committed and are noticing this as a problem. We know that the climate crisis is a health crisis, but not everybody is maybe fully aware of it, or that's bottom of their list. Whereas if we're actually putting that as the part of our logo, we're putting it as your child's care is X today because of these whatever it might be. I think that just messaging in itself is quite powerful. And I think it's so important to be an organisation, or I'm really proud to be a part of an organisation that has declared a climate and health emergency, purely because we know that's almost what the people want. There was the YouGov survey that a couple of years ago that showed that 9 out of 10 staff, so you've got a 91 or like 90% consensus there, which when else do you get a 91% consensus of agreement of that they actually wanted to be part of organisations that took climate change or seriously, and that was something that they wanted to be part of their roles. And there's been a whole load of studies in undergraduates to decide which organisations they're choosing to begin their careers in. And there was a really high percentage of people.
I've seen that where it's like a lot of employees want to work with employers who are being sustainable now. I think it's like 60-70% of people want to do that, which is massive,
a really high,
massive. Like people want to help and they care about it, and people that don't, they're not going to get anywhere now. Like
Definitely.
You need to invest in sustainability now.
You really do, because one, it's what the people want, and I think it's also, if that's what people want, then it really pushes again for that kind of like interconnectedness. So if you're actually
100%.
working in an organisation where people are like, oh yeah, no, we're really happy to talk about it. We might not have all the answers, and we might not have the ability to do all the things, you're there, but we're here and open as an organisation to listen to your ideas and hopefully get some things over the line that will help to push towards the sort of national targets. And I think that is super important, and I think that's something that more and more trusts are really engaging in, like the sort of just having sustainability spoken about, and their heads of sustainability or whoever holds that post or whoever has sustainability in their portfolio is able to sort of really be proud to be in that space, and it allows that sort of autonomy in what we're doing, giving permission for us to actually run at this rather than having to fight at every board table or whatever it is.
It's crazy when you see those of people fighting back, and it's always pushed back in some and you're like, it's why? Why are you doing this? Like, well, a lot of people want to help, and a lot of people want to do good, and then there's always that, like, the 1 or 2% that just have the negative impact on it, and
Definitely.
It's why.
But
anyway, you can't win them all. Fight your battles where you can. So obviously there's a case study showing that in 2015 staff at GOSH reduced use of non-sterile gloves by 3.1 million pairs. Unbelievable. And in doing so saved 21 tons of plastic and £90,000. So I'm sure there are many more case studies like this one you can share. Can you paint us a picture of something you've implemented at GOSH? That's a great case study. I love that one, and especially as nearly so many other hospitals are now taking on the same sort of gloves campaigns. And I just love at Great Ormond Street that the plastic stat is actually, to make it more relatable to the children, it's actually 3.5 Tyrannosaurus Rexes worth of plastic, which I think just really like gets a nice image in your head. A lot of T-Rexes. They can't fit the gloves on either.
Even better picture in my mind now. Great. But so there's been lots of different things that's been happening at Great Ormond Street, and certainly in Imperial I've got quite a few, but I guess one that we're working on right now is Great Ormond Street is part of the Healthcare Without Harm Europe's Born Green Generation project pilot site, which is trying to reduce microplastics and unnecessary toxins within healthcare settings, primarily looking at the first 1,000 days of a child's life, because we know that's when they're most vulnerable.
Yeah, of course.
And as one of the projects as a part of that to reduce some of the microplastics is we did an audit on all of the wards to look at what their highest frequency and highest cost products were. And on nearly every single ward, it was the disposable oxygen saturation probes. So it's like a little probe which has taped on, which is meant to last for 2 weeks, but we know what it's like. Children can wiggle around. The tapes become undone. Generally, they get thrown in the bin and a new one gets put on. Whereas actually, the education there should be that the tape can just be changed. We can keep that sort of plastic probe that stays there. But what we found is we thought, right, we'll trial in one ward a reusable SATS probe. This is a really simple case study. It sounds very simple, but I'm talking you through it because I think it's so easy to look past the simple swap sometimes. Yes, we tried a reusable probe on one of the wards, and we actually, just from putting a couple of probes on there was a 34% decrease in that month of them using the disposable ones. So they're still disposable being used. In children, they're not always appropriate. Each patient needs to be looked at with a different set of eyes, so it's what's appropriate. And in that 1 month, there was a saving of £5,692 just from that decrease of the disposable versus that reusable. So we've now rolled that out. We've distributed reusables to all of the wards, and from that pilot study of that one ward, we've been able to forecast for the year that even if we manage to get a 26% decrease, so it's only if we can just get rid of a quarter of what we're already using, that would save over £57,000, and which is also like 200 almost 250 kilograms of plastics and electronics going into incineration. And you think that's...
How many T-Rexes is that?
I haven't done the math on that one yet, but they can put the SATS probes on either. So
that's amazing though.
But I think that's a really simple... It's a really simple swap because we use so much reusable equipment anyway, and it is just looking at the life cycle and the reusability of products, which we've done in previous years and we're kind of falling back to again, which I think is positive.
And I guess it's again going back to that of what each step. Like what could be the next item that we could do?
Yeah, exactly.
And stuff like that.
And I think you could do one thing like the gloves and it gets people a bit more excited. They're like, oh yeah, we did that. That was incredible. We saved this. We improved patient care. We've improved staff health with their hand hygiene.
And it's quite simple.
And it's
a simple
quite simple.
Change,
And it gets people excited. So they're like, oh, what's next?
What's next? Yeah.
I think that's
you always need
key.
a driving life, don't you? And it's like, you got something to look forward to.
Definitely.
And if you can do that, you're like, yes, winning. Amazing. Honestly, that's amazing. That's amazing. Hospitals are amongst the most energy and resource intensive institutions, given obviously, there's a lot of them, with emissions spanning energy use, water and supply chains. Can you walk us through how your hospital approaches carbon accounting? What's been the biggest challenge in measuring your emissions, I guess? And what's maybe one strategy you implemented that other healthcare institutions could learn from? There's a few questions in there. I can go back to the first one, which is like, what's the biggest challenge in measuring your emissions, I guess?
I think that is... you can't lie with the challenge of what it is. It's carbon big. Accounting is huge, especially for healthcare, in the sense that it's so multifaceted and it essentially involves everybody. It's not just the walls and the energy around it. It's not just the staff, it's anybody that accesses it that has an influence over your carbon emissions. So it's really tricky. There is a challenge. And I don't think we're getting so much better at doing it, but I think there's still so much to learn, and how we can share better ways and different sort of finding sources of truth, because sometimes there's multiple sources, you're not quite sure which way to look. I think that's a huge challenge, but I think it's just breaking it down into the buckets or programs of work or whatever you want to call it that you can, and looking at the data in that, and knowing that even if you can get most of your data, but we know that there's still a slightly grey spot that we're not entirely sure what we can do with that yet. I think if you can start doing that, which I think is what we've been doing at Great Ormond Street, by breaking it down into these 10 programs of work and trying to we report like monthly and look at that on our carbon, but we're also doing things on like air pollution and having other sort of factors of metrics, tangible metrics, because sometimes it is really difficult to get a full view on what it is, but as long as you can get as much there as possible. And that's where the team, like the Green NHS team and NHS England, are so helpful. Their data and analytics team is incredible. They're and they've got so much.
They're not using Excel.
They've got some beautiful dashboards. And I think their support with trying to get trusts to be able to feed that data in, and then you can actually compare against trusts, and then you get the competition in there, and it gets a bit more exciting with people trying to reach out and find different ways. I can't deny that it is a challenge, because it's
the data alone, I can imagine, is through the roof. The NHS, it's unbelievable. Definitely. Good luck with that one.
Thanks.
Again, no, you've got this. So going back to the case study about the reduction of single-use plastic, I saw a GOSH, educators like yourself, developed a training program to reach all the nursing staff and healthcare assistants and raise awareness on hand hygiene and patient safety. So as head of sustainability education and implementation at GOSH, What's the biggest barrier to low carbon healthcare in your job funding? Cultural resistance, cultural resistance, and something else.
I always think this is such a good question, because I think if you ask people like what prevents them being able to do X to do with sustainability or greener practice, nearly always people will be like, oh, it's cost, it's tech, we don't have the tech, it's whatever it is. But actually, if you look at the research, an investment within that's net zero within healthcare actually has a return of investment of about 3.6 years, which is huge. That's better than like nearly any other investment you could do in healthcare. So I don't think we can use cost as an argument at all. No, and
I think that's becoming more and more apparent now. So I've read a study about the other day about CFOs saying like 90% of CFOs are seeing a massive ROI in sustainable investment and becoming a sustainable company. So that argument can useless now.
We'll still keep it on the table. I know it's so tricky to be able to distribute the funds and whatnot. Like I know it's not as simple as that, but I think from my perspective, I think especially in the NHS, which we've had 76 years now of a sort of a routine or a way that we practice, it's that behavioural change element that I think is one of the biggest barriers, because we've got a lot of people that understand the why, they're passionate, they want to do something, but they're not entirely sure how, and they generally don't have the capacity or perceived capacity to be able to do something that feels different, or a big leap of faith into moving something different to act on that. And I think sometimes you might say you're a new band 5 nurse and that you've got a really good idea. There's one really simple swap that will really streamline this patient pathway, which means it will actually improve patient care, but also reduce costs. And it's just like the SATS probes, for example. But you go to your ward manager and she says, no, we don't have time to focus on that. Unless you're really bold and courageous to take another step and knock on that door again and again and again, you might not have the energy to. So I think it's that really the biggest challenges is, I think it's the cultural changes, because we've even things like COVID that really unpicked a whole load of our practice with, say, PPE and single-use plastics. But then it's also I guess it's the courage to keep trying.
It's what you went back to at the start. When you were saying about the leadership and you're wanting to do something, you're wanting to fight it, but then maybe someone shuts you down or someone says no, then that knocks your confidence, and then you don't want to say anything, and then it's just about, and then you maybe might not want to speak up again. And it's like, just fight through it sort of thing. And
I think that's where the importance of having networks of things around. Like when I was at NHS England, we launched the Nursing Midwifery Sustainability Network, which is really flourished. There's a really good group on there, getting broader and broader. And I think even just stuff like that, we can be like, I tried to implement gloves off at my hospital. It's not working. Like, what did somebody else do? And within seconds, you'll get people coming back being like, oh, I've written up this protocol, use this, and this is the financial forecasting. So take this to your board director, and you've suddenly just got a wealth of resource behind you, and you've got that sort of oomph in your step again. You'd be like, oh no, I'm not doing this for. I'm doing this for a reason, and sometimes it just means, sometimes it's, I don't know whether I should say it or not, but it's sometimes easier to ask for forgiveness than it is for permission sometimes. So if you want to go and implement that thing, as long as if you can do it, then
if it makes a difference. And you heard it here first, CC Imogen in your emails in the NHS. No. if you want to make a change, here's your girl. So going back to maybe the local teams and doctors, what's something that's had the biggest impact in the NHS that has helped local teams and doctors when it comes to sustainability? Because I can imagine as a local team, you've got all these big London hospitals doing all the changes where all the big decisions are, and you've got a small little local team that maybe they feel like they can't really say much. Kind of got what we were going back to a minute ago. What would you say has helped them a lot?
I know I probably go back to this a few times in the different things, but I think the sense of permission or giving autonomy to people to be able to has been a huge part of that, being able to move from this advocacy part in health and climate to sort of the actual doing and how we actually start acting on that. But I think I would maybe say that it's things like a few years ago, and they continue to do it, there's the grants, there were little micro grants that the NHS England put out for just small, I think it was like £5,000 or up to £5,000 to think of greener innovation. And the criteria was literally kind of just that. Will it improve patient care? And will it have a beneficial impact to our carbon footprint? And I think at the time, I remember the chief sustainability officer was like, oh, no one likes doing micro grants. It's going to be really difficult no one's going to want to do it. And I think there was a bit of a battle as to whether they'd be able to do it. And they put it out, and within, I think they had over 70,000 applications come in just from, and it was getting people around, say, a GP practice to actually sit down, and they're really excited, and they were getting rung up being like, oh, can we actually put in more than one application? So I think it's things like, I think it really is that sort of the autonomy and permission to be able to be like, okay, we've got ideas, but we just need somebody to say, yes, we can do it, or here's the support that you need. I think, the elements of, autonomy, having the capacity and capability, and having fun, and having that interconnectedness. You've got to have fun while doing it. I'm
an advocate of that. You've got to work hard, but have fun while doing it.
100%.
You do it all your life, so why would you not have fun?
Exactly. I think that's the key part, and it really helps sort of bridge those boundaries of, it's not just say in a healthcare setting, it's not just the consultant's job, it's everybody that's in that setting's job.
I do agree that the confidence thing, like we've said a few times, that it is a massive thing that people won't take the jump sometimes because they don't feel confident themselves, or they feel like that you're doing the right thing, but you need what's the word I'm looking for? You need someone else to give you the backing to do that sort of thing. So like, and it will knock people's confidence. So it's a shame, but amazing. 70,000 applicants.
Amazing.
Well done. So where do you see the most exciting opportunities now? Is it on the tech side, collaboration side, or policy shifts?
Oh, I think you could have an argument for all of those, but I think from my perspective, in my experience, collaboration, for sure. I think there is... I think just looking at... I'm going to use... I know NHS again. It's one of the biggest workforces. Like, I think it's only... Massive. It's 1.4 million staff, and I think that's only like rivaled by Walmart, like the Chinese army, US army, like huge. It's a massive organisation. And you think like even just on the nursing, and currently in the UK on the nursing and midwifery register, there's 888,000. We're like the largest profession, and you think even if just every single one of those nurses and midwives was able to think of one little thing that they could do tomorrow when they get into work, one shift or one conversation they could have with their patients.
Massive.
That's if one small ask of that day, that's a huge. That's 888,000 things in one day. Like
you could say, like, what is a simple walk to work as an example, like obviously, but as a rubbish example, but something like that would make such an impact.
Or just when you're discharging your patient, have you considered using this inhaler instead of the other one? It's exactly the same, other than this one has a much lower carbon footprint. Or have you considered trying to ask your patient to take tablets instead of this IV or oral form? Like all of these are quite simple tasks, but people might not think about that until it's part of that discussion. So I think we need to find a way to really like unlock the passion of everybody and actually connect them to be able to do so, which I think we've come a long way, still a long way to go, because we are very siloed workers, even within the healthcare industry, but outside of that, in all industries, we're quite siloed, yet we could learn so much from different industries.
That's so fair. And especially with that many people, trying to manage that is a nightmare.
Definitely.
So an easy question, well, not an easy question, but a simple question. What are the changes you'd like to see in healthcare?
I think if I was going to like dream big and I could like wave a magic wand and I just hope that tomorrow I went in, I would hope that everybody had the ability of like carbon literacy. They were able to talk and have a basic understanding as to what climate and health meant and what that meant for their patients. I think if I could do that, that would be incredible, because I think people might know it, but sometimes making that connection is a bit harder, or actually seeing how that actually connects into your day-to-day professional role. I
be able to hold a conversation with it and
feel confident to speak to their patients about it, because quite often patients might be coming to them about it and they go, not quite sure what to say, so
Imogen,
where's the script? But I think just giving people that confidence to be able to be able to talk about it, even if they don't have all the stats, they don't have all the incredible things, but I think if you can just have some courage, belief in what you're saying in some shape or form, even just to spark conversations, I think that would what I'd love.
Because the more educated with it, I mean, you could say that about anything, it's easier to do and it's easier to understand. It's easier to implement, I think, when you understand even the basic side of it. It's crazy.
Definitely. Yeah, I think I know that's probably a bit of a cop out of what I would like to say.
No, I like that answer. That's a great answer. No, that's a really good answer. So for professionals outside healthcare, how can industries collaborate with the NHS to accelerate progress towards net zero healthcare without sending you maybe an email?
I think, well, as I said, there's so much that we can all learn from different industries for sure. Like, I think the NHS, like our indirect emissions, the ones that we have influence over but don't fully control, it's huge. Like, I'm going to use say our supply chain as one, like that's big a huge one where that's a whole different industry outside of healthcare. But I think the collaboration there is key. Like, so back in was it 2022 when they started doing the evergreen supply chain bits, where so by 2027 the ask was that every single supplier that the NHS has, which I think is I can't remember the stat. It's a huge amount of suppliers that they have, but they asked that they would not use them as a supplier unless they met the net zero requirements. And at the time, I remember like hearing that it was quite an outrageous thing to say. The industry was like, why is the UK saying this? They're only 2.4% of our global market. Like, we're not gonna, like, well, that's not gonna be a thing. Like, what are you asking us to do? But then it's that collaboration there where then Germany started to be interested and sort of New Zealand, Australia, Singapore.
All of a sudden that number's become a lot bigger than 2.
But it's that collaboration, and that's an international scale. But you could take that down to a local level as well. Like, I could be using this one medication for a patient, and I can see that, say an inhaler, I'm going to use an inhaler again because I think it's quite a nice one. I know that this has got a really high global warming potential with its propellants, and there's an easy swap. And I'm telling the patient or whatever it might be, I'm getting a no. But actually, if all of us and all of my patients are saying, no, I want this one, I want this one, I want this one, then eventually they're going to have to change the stock so that we can provide the one that the patients are asking for. Of course. And that's, again, just collaboration of being able to, and that's can be at so many different levels, but I think that's the key.
No, I do agree. Like, collaboration is massive. It's used in everything as well, and it's the only way that everybody can grow. Like you said, going back to the 800,000 nurses, if all of those collaborated, if all of those did that thing, like you said, with the one movement, it'd be mental of an impact.
And I think even just across industry, like the NHS, because of our sort of legislation and within the Health and Care Act, there's been a lot of work in carbon capturing data around carbon and different other sort of industry. I'm sure is such a big push in this direction now that I'm sure there's loads of different ways that we can carbon footprint X or this that will be so useful to share. And I think it's just which we are doing, but I think there's just a lot more to be done, and there's so much more that industry can also help with healthcare with trying to help people make good choices. That's or not I say good choices, you know what I mean, like a choice that's beneficial
to everyone.
Amazing.
What would you say the mantras that keeps you grounded when pushing for a systematic change in a complex institution like the NHS?
That's a tricky question, and I don't know if I particularly have
an answer,
a mantra, but I potentially would say it is this space can be so overwhelming, and it depends. You could ask me at different times of the week. You could ask me when I'm like sat having a glass of wine with my friend at the weekend. I could say X, Y, and Z, like all these different bits, but until I then have to then start implementing it, I then might be slightly more this is actually much harder, and I'll go through different phases during even just the space of a day sometimes of I'm full of hope and ambition, and this is exciting, and this is what we need to do, and then oh my gosh, it's so overwhelming, and I don't know how we can do this, and what impact am I even making? Like, that's so easy to do.
I suppose that could be discouraging sometimes, like, what am I doing? And you feel like you're not making an impact, but you really
100%. And you think even there's the argument all the time where but why healthcare when there's fossil fuel, whatever argument you want to take. But actually healthcare is if you were globally, if it was to be equivalent to a country, it'd be the 5th biggest emitter. So it's still got value. And I think the sort of my not mantra, but way I maybe keep myself grounded or inspired to like keep going or motivated is the other people that sit in this space with you. I think that's so important. Whenever I'm like, what can we do? I was going to swear a lot there, but but if you can turn around to like one of your friends that are in this space, or just some of the inspiring people, like in that fellowship I've worked with some of the most amazing team, that the Greener NHS team in particular, and the chief sustainability officers.
I bet they're a good group of people. Yeah.
They can fill you with so much ambition, even when they're telling you about all the horrible things in the world and what more we need to do. You can still, the passion that exudes from them,
it's amazing,
is so contagious that you're like, no, okay, yes, I have got, even if I can't do, again, is that perfection can't get in the way of good. Like you can at least do something, and if you can do something, then that's fine. You can't be perfect. There's never going to be a perfect thing.
You're not going to do it over one night, are you? Like, it's a small. That's why you've got the ambitious goals of 2030.
We need it to be now, but we also need to be realistic that we can achieve it. So it's all about finding the balance, isn't it?
That's amazing. So, if there's one thing you wanted listeners to remember about the NHS's climate journey, what would it be, and how can they support this mission, whether they work in healthcare or not?
Okay, firstly, I think it's really important from the NHS or the healthcare's sort of journey is that it didn't start from nothing. It's been a long process. That the Sustainable Development Unit would have started with about 1, 2, 3, 4, I don't know, 4 people around a table that were like, right, we really need to start pushing something here to decarbonise, and that has taken a good amount of time. That's taken a good few years, and yes, we want it to be now, but starting now and achieving it in a couple of years is better than not starting at all. So I think that's really important to remember for anybody's journey when they're looking at how we can become more sustainable or addressing the climate crisis. Is just thinking that you can't achieve everything all at once. So you just have to take the wins that you can and really just keep pushing for what you can. I think that's so relatable in any industry, really. And then the second part of that question. How can they support the mission? Whether you're in NHS or not, or healthcare or not, I guess. I think I would use a line which the Chief Sustainability Officer, when I started, Nick Watts, always uses. Well, he uses quite a lot, but it really resonates. And anybody that I've heard him speak, they always take this away as well. So I'm just going to share it again, even though it's it's copyrighted to him. It's to think about what are you going to do tomorrow morning at 9:00. Doesn't matter where you are, what you're going to do, but what are you going to do tomorrow morning at 9:00? What's the one little thing that you can do, and that will amount. And then if you're going to do it on Monday morning at 9. Can you do it on Tuesday morning at 9? Can you do it at Wednesday morning at 9? And then it becomes that sort of patented behaviour, and then you're also then role modelling and inspiring other people around you. And I think you don't have to think of the best innovation or the next best tech or the next whatever it is. It might literally be a smaller thing of can I walk? Can I get off at the? Can I take the tube and walk instead of driving to that? Or that's a personal one, but depending on where you are, what you work, there'll be so many different things. Or can you get a group of people around the table and say, can we put sustainability on our next agenda just to discuss? Let's see who's interested. Just want to find that out. Of course. Like just small things that you can do. Small things every single day sort of thing. Amazing. So I guess last questions, we're coming to the end. If you had to leave healthcare tomorrow, what field would you choose to advance sustainability? Again, I think everyone needs a bit of a cop-out answer here because I'm an educator. I would move into. Not another one. I would have to say I'd move into education because I think even outside of healthcare, I'll allow healthcare. I think it's so important that we begin to embed that knowledge into schools, pre-reg, whether that's healthcare courses or non-healthcare courses. I think it's so important that that education of the impacts of climate change is huge because it's just without health what can we do? So I think that getting that knowledge there so that people can actually be aware of it and start taking sort of understanding the why, the what, and then really embedding in the how. That's amazing. Look, honestly, this has been great. I've learned a lot. I'm definitely an NHS person now. I will be walking to work. I will not be calling. But no, honestly, that's amazing. You're amazing. Thank you so much for everything you do, and thank you for joining today. Thank you. Thank you for joining us. If you found today's episode good, inspiring, want to listen again, please subscribe to the Leaf Media Global podcast on YouTube or follow on Spotify and Apple Podcasts to never miss conversation.
Leave a review to help others discover the show. Drop a comment with the biggest takeaways and share with this episode with your friends and colleagues. Follow us at Leaf Media Global for updates. I'm Ben Simpson-Wood at Greenlee, and we will see you next time.